This is a core activation with a knee lift. So I'm laying down, head supported, and I first just want you to get in a comfortable position. If you're in any discomfort, just kind of get as comfortable as you're going to be here with the knees bent, feet flat. Take a big breath and exhale all the way like you're blowing through a straw. And just let everything go. That helps to set our rib cage position. On your next breath, you're going to inhale and exhale all the way and just squeeze all the air out to engage a bit of your core here. Maybe a little bit of drawing in or kind of pulling away from a belt line, but we should feel some engagement right by your waistline. And so if you're not quite feeling that, we have some other videos on core activation, but we want to feel some work here without your low back muscles kicking in. Then we're going to try to keep that engagement as you lift a knee about 4 to 6 inches. That's it. So you're going to maintain the core activation as you lift a knee. And as you lift, you're not pressing down more through the foot. The feet are just hanging out nice and light on the ground or the bed that you're on. Remember to breathe. You exhale, maybe get a little more core squeeze. We're going nice and slow and controlled, trying to maintain this core activation as you move the legs around. Okay, so that's the whole exercise. So the purpose of this is to help reestablish some core activation without other muscles, often the lower back muscles, over activating. Sometimes we see them over activating by lifting from the table, but sometimes we don't even see that. And what we see as the knee lifts up is muscles here turn off and the low back muscles kick in and grab. Or we can have engagement in both places. And so what we're trying to do with the exhale initially is just to let everything go, but also to bring the rib cage down a bit. A lot of people with various kind of breathing patterns don't exhale all the way. And then if I exhale and push all the air out, for most people, that will engage a bit of the abdominal muscles. If you don't feel that, just a light kind of drawing in by the waistline, almost like you're pulling away from a belt. Another cue is like somebody's going to kind of poke or tickle you. Don't want to let them, but I want to establish this abdominal engagement without the low back muscles kicking on. That's step one. Then I want to see, can you breathe without losing the engagement? And then we're going to add this knee lift up and down, remembering to breathe. So I have a whole core activation sequence that progresses from here, but often this is a great exercise to start with. And if it gets easy, I just cognitively squeeze a bit harder. So I can create a lot of muscle burn here by just focusing on engaging the muscles harder. Just like I can squeeze my fist light, I can squeeze it hard. So I can really squeeze and come through there. So often we'll stay on a variation like this that looks simple, but if we see that the low back engages in more dynamic or complex positions, then I want to regress back and see, can I maintain the same activation and maybe add some endurance or add some additional squeeze. And so we are using this to establish connection, neuromuscular connection with the right muscles. This is often not an endpoint exercise. We then take that activation and go do something with it. But this is a great starting point and can be a great warm-up exercise or component of somebody's plan if we see inhibition of the core and overactivation somewhere else. Of course, if you have back pain, check with your physical therapist or healthcare provider. Don't continue through pain, but if you feel work here and low back stays relaxed, you're probably on the right track.